Ooh. Hello viewers, welcome to Family Vibe TV. As usual, I'm your friend and the host, Kobe Chisom Ferdinand. With me here is still our dietitian, Oniroka Simeon from Teaching Hospital. Okay, he will introduce himself as we progress. Today we'll be treating a topic that says carbohydrate counting and insulin distribution. And you know, our dietitian here will do justice to that. So I will allow him to introduce himself in our usual tradition and then proceed immediately with the topic. Thank you.
Thank you, our viewers. I'm your friend, the regular host on this TV, Family Vibe TV, dietitian Oniroka Simeon, a chief dietitian consultant at Nnamdi Azikiwe University Teaching Hospital in Anambra State. Okay, thank you. So just like the moderator have said, we're going to talk on carbohydrate counting and insulin distribution. It's relatively a newer area in diabetes management. Carbohydrate counting and what? Insulin distribution. So relatively a newer area. So I want us to have an insight on it. So just like I've explained in our previous video when I was telling you type 1 diabetes and type 2 diabetes. I've told you, if you can remember, that type 1 diabetes is usually insulin dependent. This is how that insulin now comes about. How do you count the carbohydrate food you eat with the insulin injection you are taking? You need to match, otherwise there will be problems. You cannot control your blood sugar. That's what brought about that carbohydrate counting. Now, how does it work? The carbohydrate counting is taking note of all the carbohydrates, all the grams of carbohydrate food you have taken. That is all the grams of carbohydrate. What do I mean by grams of carbohydrate? For instance, if you are taking bread, let us say it's a breakfast recommended for you. Say take 2 slices of bread. Let us say you have a diabetic patient on our list. Say take 2 slices of bread. You have to take note of how many grams of carbohydrates are in 1 slice of that bread. Then multiply it with 2. Of course, when you multiply it, you know the total number of carbohydrates. Okay. For instance, if you say 1 slice of bread has about 3 grams of carbohydrates, you now have to multiply that 3 grams. You now have to bring out that 3 grams. So the 2 is totally not 6 grams.
6 grams of carbohydrate. Yeah, that's sugar.
Fine, sugar. 6 grams of sugar, for instance. Now you have to take note of the, let us say, if you say it's taking milk or tea, if there's carbohydrate content in that milk, you need to take notes. If you're taking 1 whole egg or boiled egg or fried egg, okay, that's also a boiled egg, you have to take note of carbohydrate content in this 1 whole egg. Okay. Now, when you bring them out, you sum them up, because say at the end, you now say there are 32 grams of carbohydrate in this breakfast. I'm just giving an instance. There are 32 grams of carbohydrate in this breakfast. What is next? You now have to know the unit of insulin this patient is taking. First of all, you have to know type of insulin. Is this long-acting insulin or short-acting insulin? The doctor in endocrinologist will know this I'm talking about. Now, if you discover whether it's short-acting insulin or long-acting insulin, then what next? What is the unit of insulin you are taking? For instance, we have it that about 10 grams of carbohydrates will take care of 1 unit of insulin. Okay. 10 grams of carbohydrates will let us say, take care of 1 unit of insulin. Assuming that you are taking 60 units of insulin every day. Let us say, insulin is usually measured in IU, international units. What's the measurement? Let us say you take 20 in the morning, 20 units. Okay. In the afternoon food, you take 20. Then at night, you take 20. It's not about 60 units. So in that, I'm using breakfast for instance. If there are around 10 grams of carbohydrates on that breakfast, or 30 grams, you now have to say, okay, 10 grams of carbohydrate will take care of 1 insulin unit. What will 20 units take?
That is, in mathematics we call it if more or less divided.
Exactly. I get it. That is how they get the calorie that patient requires. Because you don't just have to start giving the patient any calorie the patient wants. At the end, you might end up in making the patient entering hypoglycemia stage or hyperglycemia, with sugar rising. And you say you're taking insulin and you're taking diet. So the insulin have to match with the diet. So now, if you're taking, you said example, 10 grams of carbohydrate will take care of 1 unit of insulin. Therefore, what did that 20 grams you're taking in the morning will give you? Now convert. You get the unit of insulin the patient requires. You go to afternoon food, you go to your night food. At the end, you'll be able to calculate all the calories that will come from that food. So that when you say this patient needs 2,500 calories, you must have taken care of the insulin units that will match that.
So they will match it.
Exactly. Well, this insulin, usually what they do in the hospital from experience, you just give it to the patient prior to your eating, maybe 30 minutes before you eat.
Eating time.
They will give you the insulin 30 minutes. He said, don't eat till 30 minutes. You wait 30 minutes and not serve your food. But then the insulin must have gone inside your system. So now act on that food that you eat later.
Okay.
So that food you eat later, that's the essence of this, what I'm trying to describe. That food you eat later, the calorie from that food must match the unit of insulin you have taken. Otherwise, there will be hypoglycemia and hyperglycemia.
Okay.
That's what I wanted to understand with this video. You know, when we research, we go higher every day. So note that it's not just about eating diet or recommended patients.
Okay.
Particular calorie of food by a dietitian or anybody. Take care of the insulin the patient is taking. So the doctors work in hand with dietitians to know the type of insulin they are using and the unit it has. Then compare it to the grams of carbohydrate that come out with on the food the patient will eat, both morning food, afternoon food, and night food. Even snacks.
Even snacks?
Yes. If there's any snack. What I mean by snacks is not the usual meat pie. Let us say you are taking taking biscuit, for instance. Let us say biscuit was allowed as a snack. Take biscuit. Then you take the carbohydrate from that biscuit.
You add it.
So that at the end, the insulin unit will carry that calorie of.
Now, coming from what we discussed now, let me ask on behalf of the viewers, how do you want to maintain it? Do you guys have a chart, maybe a carbohydrate intake chart, for instance? Because I know if something like that is not maintained, it is possible that at a time, someone will not remember what this man is, as in carbohydrates.
Yeah, exactly. I know we are agreeing.
So, is that something like a chart, or how do they maintain accurate order of carbohydrate intake of the
You don't even need to make charts. As a dietitian managing a patient, I'm talking about the inpatient now, for instance. If it's an outpatient, and I know how to deal with you, I know how to manage you with this insulin I'm talking about. It's a different case. I'm talking about a patient lying in the hospital, whereby the dietitian will provide the food. We have done that in our therapeutic kitchen, therapeutic diet kitchen. We have done the calculation before we bring it to you. I've already known that this is the calorie of food we are making as a breakfast. This is insulin they are taking. It will match.
Okay.
Do you understand what I'm saying? Okay. So the patient don't need to worry. This is our profession. We didn't do good and research and know. Plus or minus of this I've told you now. I use bread, use egg, use milk, use other food. Even if it's yam or anything, you can use calculate the quantity of carbohydrates or gram of carbohydrate that are coming out from that food. So that you're able to know the calorie of that food. Because for knowing the grams of carbohydrate that are coming from that food, you know the calorie. That's what we call hot water factor. Mm-hmm. If it's carbohydrate, you use 4 to multiply. If it's carbohydrate food, you use 4 to multiply. If it's protein food, you use 4 to multiply. If it's fatty food or fat, you use 9 to multiply.
Okay.
To get the calorie. So we need to do that in our kitchen. So it should not be a problem. It's a private candidate that's outpatient. I probably know how to manage you with that. So it's not a problem. Thank you very much.
Wow. Viewers at home or wherever you are, you can as well see that this is for taking care of. What we have here are experienced persons. He too is an experienced hand. You can see it from what he has told you so far. And I believe that we are giving you your best health concern here at Family Vibe TV. So, and we are going to wrap it up at this moment, pending what we see next time on a topic that says importance of dietary fibers. Till then, see you and stay healthy, stay focused. Don't move away from that. Subscribe.
Ooh, yeah, 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 yeah.